Today I am going to tell you about ccTGA, congenital corrected transposition of great arteries. The meaning of congenital corrected transposition of great artery is the great artery, aorta and pulmonary artery. Aorta is systemic vessel. Aorta remains as a systemic vessel and pulmonary artery drains primary to lungs, that is corrected transposition of great vessels. In congenital corrected transposition of great vessels ccTGA, right ventricle is a systemic ventricle. Right ventricle is usually venous ventricle, but in ccTGA right ventricle is a systemic ventricle because right ventricle is a systemic ventricle. Usually patient present with heart failure in third or fourth decade. Most of the patients of the ccTGA have associated congenital heart disease like ASD, VSD or other valvular pulmonary stenosis type of lesions. Second, the patients of ccTGA many patients have conduction defects. So this type of patients may need pacemaker implantation in later life. Third, the right ventricle, the identification of the right ventricle in echocardiography is by moderator band. Because right ventricle is a systemic ventricle, on transthoracic echocardiography you can see right ventricle on the right side of the screen. The tricuspid identification of the tricuspid valve on echocardiography is tricuspid valve is usually apically situated and tricuspid valve always opens into right ventricle. So the blood from the pulmonary veins drains into left atrium and through the tricuspid valve blood goes into right ventricle, and through the right ventricle blood goes to the aorta into systemic circulation. The venous circulation typically goes into right atrium and through the mitral valve opens into left ventricle. So left ventricle is normally systemic ventricle, but in ccTGA left ventricle is a venous ventricle. That means left ventricle act as a right ventricle. So the blood from the left ventricle goes to lungs through the pulmonary arteries, and in the lungs the pulmonary blood goes into oxygenation process and drains back through the pulmonary veins into left atrium. So echocardiography is a very diagnostic tool for diagnosis of congenital corrected transposition of great vessels. Some patients of congenital corrected transposition of great vessels have ccTGA associated right ventricular systolic dysfunction, and atrioventricular valve regurgitation is also common. So on echocardiography tricuspid valve regurgitation is very common. Some patients may require tricuspid valve replacement in later in life. Friends, please like and subscribe.